Angela Myers, Medical Healing Center. Thank you for giving us this interview. Angela, you've always helped so many people, chronic illnesses, invisible illnesses, Lyme disease. I want to go straight to the heart point. Why Lyme disease and why these invisible illnesses are so in the middle, in such a controversy? Why are they so hard to treat? Why doctors don't want to treat it? The general community, I'm saying, why this is such a hard topic?
I think it's hard because there is a lot of political pressure. And I don't mean Republican versus Democrat, but what I mean is that with the medical community, part of the problem with chronic illness is, I think in traditional medicine, we look at symptoms. They're like, oh, this happened. And what we do is we actually treat the symptoms. And what the symptoms really are, they are the body's way of telling you that something's wrong. And so we have to figure out what's wrong with the functional body. Because you can treat symptoms and they'll get better for a while, and then other symptoms come back. And I've seen so many people on so many drugs, and it's been because the functional body was not corrected. And so when we look at chronic illness, what we found out is that people usually have toxic exposures. And let me just tell you, we live in a very toxic world, very toxic. And then what happens is a lot of people either have a familial history in their family of not being able to detox. And so they don't detox these toxins. They build up and they create autoimmune dysfunction. Mm-hmm. And so the immune system is not functioning properly.
Angela, what infections do you look at when you treat Lyme disease?
We look at subclinical infections. A lot of time it can be strep, we've seen toxoplasmosis, we've seen cytomegalovirus. We've seen a lot of different infections. Mycoplasma, which is a co-infection of Lyme. We have seen multiple Epstein-Barr. And when we talk about Epstein-Barr, that has over 74 species. And some of the species that are occurring now are very resistant. And so they're difficult to treat. We do have things that we can treat it with. We have it at different levels. And then the other part of this is that you're dealing primarily with a cell wall deficient organism. And the way the immune system works best is it bounces off of a cell wall and then goes back and it gets picked up that way. Well, when you're dealing with an organism that's a rickettsial organism and it does not have a cell wall, it's very difficult to pick up. It won't pick up on lab testing. Interestingly enough, the CDC actually says you don't have to have a positive Western blot. But what you do have to have is a history, so like a tick bite. We used to diagnose it by erythema migrans rash. We don't even have to do that anymore because we can see just a little rash and it may be red and we get symptoms. And we used to see what we call the tertiary or late symptoms later on down the way. And now what we're seeing is those tertiary symptoms of neurological stuff, all that presents after a tick bite immediately. And so again, it tells me that your immune system is not working well. You've got other things there that are affecting the immune system, and we have to look at all of those components. And we have to treat all of those components at one time as well.
How do you treat, Angela? Those complicated cases?
It depends. We have herbals. We do homeopathic. Eric, my husband, and I do homeopathics. We do supplements. We use antibiotics. We use a lot of detoxing. We use IVs. We do a lot of IVs because we have an infusion center here. So, it just depends. Not one thing treats all. I just will tell you that we have to look at the person individually, and then we have to assess what we need to do. And there's different levels of treatment.
But I also saw that you do a very comprehensive testing, which is very different from going to a regular doctor.
People are telling me it's like 19 vials or something like that. I hate to say this, I don't want to be known for this, but I've been told that I'm known for the amount of blood that I take. So sorry about that, but we are very comprehensive and we do look at a lot of different things because we have to look at a lot of different things. We look at the immune system for bacterial, we look at the immune system for viruses, we look, Eric does the QXCI or SKIO, and he really is amazing at looking at parasites, and there are a lot of parasites. And a lot of times those can't be picked up by labs, but he can pick those up as well. And he actually does energetic treatment. So there are energy waves and frequencies that can actually destroy parasites. He can pick them up with energy frequencies, and he also can treat them.
So it's a lot of testing to see what do you need specifically for each person.
And it is very individualized because we're dealing with the person's functional body. And that has to do with your history, that has to do with your genetics, that has to do with, your environment, it has to do with how you eat, how you, what you do. So there's a lot of different components that we look at.
Angela, and that is very difficult to find because usually it's like one shoe for everybody. It has to fit everyone. You go to a doctor, you can only have one symptom and that's what they're going to treat. So here it's complicated for you. How do you guide yourself besides those testing?
I do treat by symptoms, but again, we look at the whole functional body because what's off is your functional body. And that's the basis of getting
Which is the functional body?
It's your whole body. It's like your liver, your kidneys, your lungs, it's your immune system, it's everything. How you detox. If you've got autoimmune, we have to treat that. We treat that with a lot of times with low dose naltrexone if people can do that.
Talk to me about results for chronic disease patients and Lyme disease. What have you seen in your practice?
Well, we've gotten people on disability back off of disability and working again. And there's no reason why you can't do that unless your functional body is so damaged that we cannot bring it back. We have really good, I just was thinking of a patient who came in that had uncontrollable diabetes and insulin sensitivity, and she was on insulin. I discovered from her history and her labs and everything, her particular diabetes was an autoimmune dysfunction. There was nothing in the family history about diabetes. And everything pointed to autoimmune. So we put her on low dose naltrexone. She came back to me 3 months later. Her diabetes was under control. We did labs. Her insulin, she had no insulin sensitivity. And she said, I'm not leaving until I get my low dose naltrexone refilled. Because she says that's what did it for her. So you just really have to focus in on what the problem is for the person. And this person didn't have Lyme disease, but still had autoimmune and lots of things going on.
Angela, your message for people who are desperate, who are hopeless, and who need answers, what would you tell them?
Come see us. The other thing is I just want to say too that, I'm actually, I'm going to be 73 this month, but I'm going to tell everybody I'm still 39. It worked for my mom, so I'm going to go ahead and do that.
Wow.
But what I want to say is that, it's really different for different people, and you have to look at the history. But one of the things I want to say, you can keep a lot of things away. I've been in medicine since 1976, so that's a long time. I remember people looking healthier. We had a lower incidence. I just read an article about the incidence of diabetes has risen, I want to say like 50% in the last 10 years, 15 years. And what's changed? The food we eat. We now are eating genetically modified foods, which your digestion does not recognize and does not process. All it does is create inflammation. So my recommendation here in the United States, all wheat products are genetically modified. And so you have to stay off gluten, because if you don't, you're going to create inflammation and it'll be in the whole body. You'll be puffy and you hurt, all that kind of stuff. So it's your diet. No processed foods. You need to eat whole living foods, and they need to be organic. You need to have grass-fed meat. We need to get away from the chemicals. Okay? Because you're not getting nutrients from that. All you're getting is a dysfunctional GI system, which is 80% of your immune system. Eating is very important, and what you eat is very important. Secondly, exercise. We are like cars. If you don't exercise, you're going to rust just like a car does. Okay, it's very, very important. They're doing more studies on exercise, how it helps diabetes, it can reverse diabetes, diet and exercise, and how it helps joint pain, how it helps mental illness. I mean, I can go on and on and on. There's just numerous studies about exercise. The next thing you need to do is you need to understand that we don't farm like we used to. We used to rotate crops because every crop will, from the dirt, get certain nutrients, and that's why we have to do that. We don't do that much anymore. So we're not getting a lot of the nutrients that we were getting in the old, as I call the olden days. But look at our families, how long they lived, 80s and 90s, and they didn't have the autoimmune dysfunction that we have now. We need to take a look at this. What I'm saying is you do need to take supplements because you're probably nutritionally deficient. Get a good multiple vitamin. You need to get your vitamin D check. It's a very, very big vitamin, and it needs to be at least 80 to 90. It's an antiviral, anti-cancer. It helps the immune system. It helps with bone loss. I mean, they're just going on and on and on and on about vitamin D. You just want it 80 to 90. And also, B12 is very important. I recommend methylcobalamin because it's methylated, and a lot of people have what we call methylation defects, and they cannot process things that aren't methylated. And one of the things I tell people, when you eat asparagus, does it smell like sulfur? Because if it does, that means you can't methylate. And so you need to have methylation. You need to have something that's methylated like methylcobalamin, methylfolate. Those are just a few of the simple things that you can do in your life to help keep yourself healthy.
Thank you, Angela.